Hello there, everyone. My name is Henry. Today I will be discussing virtual reality (VR) and augmented reality (AR) and the impact on healthcare field. Those technology are uh, rev revolutionizing how medical professional train, diagnosis, and um, and treat patients. We will explore about their emerging application potential, benefit, risks, and that they bring to healthcare. Um, I've always been fascinated by how technology is reshaping the medical field. VR and AR are some of the most exciting innovation I come across. Those two are no longer just futuristic concepts, but real solution that improve patient care today. So let's go about introduction. So what VR and AR? VR is a technology that immerses user in a completely digital environment, um, usually through a headset. Um, so it create like a simulated experience that can be replicate real world scenarios or entirely new environments. Augmented reality, AR, on the other hand, enhances the real world by overlaying digital elements, um, assemble images, text, or data onto a physical environment. So like it's like you can see those stuff through the real environment, like the physical environment that you're sitting. So with AR, you can be experienced through devices like smartphone, tablets, or AR classes. Um, um, overview of their immerse in healthcare field. So both VR and AR have gained significant traction in healthcare industry over the past decade. Initially, those technology were primarily used in gaming and entertainment mostly, but as the potential became evident, the medical field started adopting them for training, diagnostic, and treatment. So today, a lot of leading hospitals and medical institutions are integrate VR and AR into their workflows, providing a lot of value in enhancing patient care, improving healthcare outcome. The importance of those technology in modern medical practice, VR and AR in healthcare is transforming from like how medical professional operate. Um, is is offer innovative solution for training medical student nurses assisting them in complex surgeries and even treating patients with chronic condition um, by providing immersive and interactive experiences. VR and AR helping doctor, nurse, and therapists deliver more precise and effective care. Um, it also allow patient engage more actively in their treatment plan, like it's making healthcare more accessible and personalized for patient. VR and AR are really edge technologies, making significant strides in healthcare industries. VR provide immersive digital environment that allow medical professional to practice procedures, um, while, while augmented reality overlay digital content onto real world to enhance surgical precision and diagnostics. Um, it's really shaping the future of healthcare. Um, Potential impact on healthcare delivery system. The first one we have medical training and education. Um, So like VR-based simulation for surgical training, medical procedure, like I said, AR in enhance anatomy visualization for medical student, nurses as well, reduction in learning curves and improvement in proce- procedural accuracy. Um, so it's really a game changer for medical training. Um, like imagine being able to practice procedure a lot of time in AR and VR um, setting before touching like a real patient. This will be really hand-on practice. Patient treatment and rehab. Um, so like VR can be um, used for pain management, PTSD treatment, and cognitive therapy by immersing patient in a calmer environments. Um, so physical therapy guidance and post-stroke rehab as well. It can providing like it can provide like real-time guidance and feedbacks to patient undergoing rehab. Um, and I have read studies showing that VR is highly effective in managing chronic pain. Um, it if it can reduce the need of opioids and other pain medication, it could make a huge difference in healthcare. Um, Surgical and diagnostic enhancement. Um, so AR assist surgeries improve precision and reduce risk. VR for pre-surgical planning and stimulation, giving like doctor better insight before performing a real procedure. AR-based diagnostic aiding in complex condition like vein visualization for injection. Um, I personally struggle with finding veins in some patient, and AR guide vein finder would be a lifesaver for those situation. Um, so it's really simple but powerful way AR can improve patient care. Not letting patient get poked so many times. Direct application to the PCU nursing practice. Um, As a nurse in PCU, VR and AR um, have practical application that can enhance patient care, include enhanced patient like bedside monitor for real-time patient data, visualization, um, so that we can make a quick decision um, based on that, um, and VR-based patient education tool to improve understanding condition treatment. It will save us so much time for educate patient um, and treatment, like and explaining stuff for patient um, in a really interactive way. Guide vein fighting device to enhance IV injection efficiency, like I said um, in the previous slide. Um, so what is their benefits? Um, Improve patient outcome and reduce medical errors. Um, Thanks for enhanced training and precision. Um, in, it can help us to increase patient engagement and compliant with treatment. Um, and it's also efficient learning and training opportunity for healthcare providers. For the risk, so it's really expensive um, and require a lot of training, um, data privacy concern, and cyber security threats, risk, ethical consideration, including patient consent and dependence on technologies. Um, Wise have a lot of benefit. I also understand that not all hospital or clinics have the resources to implement this technology. It's really important that we find ways to make these tools accessible to all healthcare provider. Um, social, um, social, cultural, and ethical implication. Um, so with though, no matter how advanced technology gets, we must remember that um, human touch and empathy are not replaceable in patient care. Technology should enhance but not replace the personal connection between caregiver and patient. Um, so conclusion. So VR and AR are transforming healthcare by improving training, patient treatment, and surgical precision. Um, why why there are risks and ethical consideration to address, this technology hold great potential for enhancing both patient care and the efficiency of healthcare professional. As we continue to advance, integrate VR, AR into medical practice will become very crucial and a lot of benefit for us. Thank you for your time, and I look forward to any question you may have. This is my reference that I use in this um, presentation. Thank you.